Good morning to everyone. Myself, Dr. Monisha, lecturer cum medical officer, Department of Yoga and Physical Culture, JSS Institute of Naturopathy and Yogic Sciences. So, on the occasion of World Cancer Day, I am here to present cancer awareness, prevention, and early detection. So, what is cancer? Cancer is nothing, it is an abnormal cell which is an uncontrolled division of cells known as cancer cells that invade and destroy the surrounding cells. So, cancer cells are different from normal cells in some aspects. They do not remain confined to one part of the body. They penetrate and infiltrate into the adjoining tissues and dislocate their functions. So, some of the cancer cells get detached from the main site of the origin. The main site of the origin is called primary growth and travel by blood or lymph to sites distance, another site. So there they form the another kind of tumor from original tumor. It is called metastasis or secondary growth. Okay, now how do cancer cells differ from normal cells? Normal cells have a limited lifespan. They are usually replaced by new cells through cell division and cell differentiation. So, their production is regulated in such a manner that the number of a given cell type remains nearly constant. They won't change. Normal cancer cells show a property called contact inhibition. Due to this property, they contact with other cells and inhibit their uncontrolled growth. These cells proliferate in an unregulated manner and it clones of cells which can expand irregularly. This uncontrolled growth of cells is known as tumor or neoplasm. So, okay. Now, properties of the cancer cells, how it will be like. So, it has a uncontrolled proliferative ability and it has a extracellular growth factors are not required. So, overgrowth and ability to invade new site. It is called metastasis. I already informed. So, nucleus becomes irregular with abundant granules. There is increase in number of lysosomes and reduction in mitochondrial cristae, more melanin and debris in cytoplasm. So, cancer cells resist induction of cell death, which promotes development of tumors. Okay, types of cancer. So previously we have seen about what is cancer, how it spreads, what is a primary cancer and what is a secondary cancer, what is a metastasis. We all discussed previously. Now coming to types of cancer. There are over 100 different types of cancers in our body based on their site, based on the organs we are classified. So some of the common cancers include breast cancer, lung cancer, prostate cancer, colorectal cancer, and skin cancer. So other than this, we are having to classification leukemia or lymphoma, the cancer which arises in the blood. It is called leukemia, the cancer which arises from the lymphatic system called lymphoma. So based on this, we are categorizing into two major types. One is benign cancer and another one is malignant cancer. Now coming to benign tumor. Benign tumor, it is not a cancer, it is a tumor which is not malignant, it is not a harmful thing. So it remains in the same site. It won't proliferate into, it won't multiply or it won't spread from one place to another place like primary site to secondary site. It causes limited damage to body and it is not cancerous. Now coming to malignant tumor. Malignant tumor is a cancerous tumor. First, it grows slowly. After it grows very fastly. So initially, we don't have seen any symptoms. No symptoms are noticed. This phase is called latent stage. The tumor later grows quickly. The cancer cells go beyond adjacent tissue and enter the blood and lymph and move to the any other site of the body or organ and develops a secondary growth, which is this process is already I explained called metastasis. So once this happens, they migrate to many other sites or any organs and cancer cell continue to divide. A phenomenon in which cancer cells spread to distant sites through body fluids like blood or lymph to develop secondary tumor is called metastasis. So, based on the tissue from where they arose, cancers are classified into three main types. One is carcinoma, second is sarcoma, and third one is leukemia. First one is carcinoma. Carcinoma is nothing. The cancer cells which is derived from epithelial cells. For example, cervical cancer, breast cancer, skin cancer, brain cancer, lung, stomach. These are the cancers which is derived from epithelial cells. So it comes under the category of carcinomas. Overall, 80% of tumors are considered as carcinomas. So here I mentioned a few examples. If the cancer cells grow from a melanocytes called a skin called melanoma, if the cancer grows in the gland is called adenocarcinoma. If the cancer cells grows in a muscle or tissue is called myoma. Now coming to sarcomas. Sarcomas is nothing. The cancer cells which is grows in a connective or muscular tissue. Previously we saw it is grown from an epithelial tissue. Here it grows from connective and muscular tissues. It is called sarcoma. Yes, sir.
Sorry,
కొంచెం Okay, sorry for the interruption. Okay, now moving to sarcoma. So I already told you this cancer cells which arises from the connective or muscular tissues. Previously, we saw it arises from epithelial cells, which is called carcinomas. So here, for example, if the cancer cells arises from bones, it is called osteoma, or if the cancer cells arises from adipose tissues, called lipomas, or the cancer cells which is arises from lymphoid tissues called lymphoma. So we are moving to the next type, leukemia. Leukemia is a nothing. The cancer cells which is arises in the bloodstream or white blood corpuscles. So that is increased in the count of white blood corpuscles rapidly, which is called leukemia. Leukemia, or commonly called blood cancer, it is common among them. And now coming to causes of the cancer. What are the major causes are there to for cancer means? First one is physical irritant, second chemical agents, radiations, and biological agents. So first, physical irritant. Physical irritant, here I mentioned a few of the examples. First one is use of concrete. Means an earthen pot containing burning coal. In Kashmir, they used this to maintain their temperature to become warm. They are using this burning coal on their abdomen. So it majorly causes abdominal skin cancer. So next one is betel and tobacco. Betel and tobacco, we all know. Chewing betel or tobacco causes oral cancer. And now coming to third one is smoking. Smoking causes lung cancer. Either active smoking or passive smoking, it causes lung cancer. So it affects oral cavity, pharynx, throat, and the larynx. So now coming to jagged teeth, there is a misalignment in the teeth by birth itself. These persons may are prone to tongue cancer. So next one is excessive exposure to sunlight, which cause skin cancer. These are the physical irritants which trigger the cancer cells. And now coming to chemical agents, there are several chemical agents are known to produce a cancer. Here I mentioned a few examples: caffeine, nicotine, like coal, oil, pesticides. These are the chemicals, and the constant use of artificial sweetener can cause cancer. So, other than this, here I mentioned animal protein. Animal protein rich diet also prone to cancer in large intestine. So, breast cancer. Breast cancer is commonly related with the hormonal relationship. It is most commonly seen cancer in all over India, and it is caused due to sex hormones and steroid variations. So, if the sex hormones and steroids are secreted in a large amount, may cause cancer. And last one is chimney sweepers. The persons who are working in the chimney sweepers industries, they are prone to scrotum cancer. And the persons who are using dye or dye workers are prone to bladder cancer. Now coming to radiations. In radiations, X-rays, cosmic rays, UV rays, these are the things which can cause cancers. So there is one incident, Japanese people, during the World War II, Japanese people are exposed to nuclear bombing. It shows 5 times the incidence of leukemia seen in the rest of the common population or unexposed population. Now coming to biological agents. Biological agents, here I mentioned some of the viruses and other parasites can secrete excessive hormones and are believed to cause cancers. So these are the causative agents for cancers. And here I mentioned a few examples which is related with the affected organs. So carcinogens or which caused cancer cells. So here, first one is soot which affect skin and lungs. Soot is nothing but it is a kind of coal, and coal tar is affect skin and lungs. Then cigarette smoking, we already discussed this. It will cause lung cancer. Next, cadmium oxide. It is a kind of metal. It causes prostate gland. cancer. And now coming to aflatoxin, it is a kind of fungi, the mold metabolites, which cause the liver cancer. And now coming to naphthylamine and 4-amine noviphenol, which cause urinary bladder cancer. And mustard gas cause lung cancer. Then nickel and chromium metal cause lung cancer. Asbestos, we all know about this. It will cause lung cancer, pleural membrane cancer. And diethyl stilbestrol DES, it is a medicine which is earlier used earlier to prevent unwanted pregnancy complication. Now it's been stopped. This medicine is caused vaginal cancer. Now, coming to symptoms of a cancer. What are the possible symptoms we can observe if the patient is having a cancer? What kind of cancer? This none of thing. And first one is persistent cough or hoarseness in a smoker. And if the smoker is having a throat cancer, means these persons is having a persistent cough, continuous cough, and persistent change in digestive and bowel habits. For this cancer patient, there is a change in bowel habits. So sometimes they might prone to constipation or sometimes even diarrhea. Then change in the wart or mole. And we can observe a lump or hard area in the breast, in breast cancer. And unexpected diminished or loss of appetite. The person who is prone to cancer, the person who is affected with the cancer, these persons won't get a proper appetite. And there is an unexplained low grade fever, continuous low grade fever we can notice in the cancer patients. And unexplained weight loss. We all know weight loss is the common thing we can observe for a cancer patient. And any uncurable ulcer. If the ulcer is arises means, or if the ulcer is caused means, it won't cure easily compared to the normal person. And bleeding in vagina at times other than the menstruation. And non-injury bleeding from the surface of the skin, mouth, or any other opening of the body. So these are the symptoms we can observe in the cancer patients. And now coming to causes and risk factors. So we cancer is caused by mutations in the DNA of the cells, which prone to proliferation or abnormal growth of these cells, which is triggered by internally or external factors. These include genetic predispositions like aging, exposure to harmful substances. I already told about this, like tobacco consumption, or exposing to radiations, or exposing to any infections such as HPV or hepatitis, or due to unhealthy lifestyle habits also trigger cancer cells. And by understanding these risks, help in both prevention and early detection. So it is important to note that while some risk factors like genetic cannot be changed, others can be somehow managed and minimize these symptoms. We can increase the life expectancy by following all the proper healthy lifestyle habits. And now coming to adopting a healthy lifestyle means eating a natural food, fruits, vegetables, and a regular exercise, proper routine, and avoiding those triggered factors, which is internally and externally, tobacco, alcohol consumption, smoking. We have to avoid those factors. Okay. Now, coming to how cancer is diagnosed, there are many investigations are there to diagnose the cancer. So we are commonly using here X-rays, CT, and MRI, and some lab test, blood test also we are using. At last, we are it is a confirmatory test we called biopsy. This biopsy is it is used or examined under a microscope. Okay, now coming to detection and diagnosis of cancer. So first one is bone marrow biopsy. So here what they'll do means a piece of a suspected tissue cut into thin sections. So in affected area, a piece of a suspected tissue cut into a thin sections, and it is stained and examined under microscope by any pathologist. And they can observe abnormal count of WBCs in leukemia. So these are comes under bone marrow biopsy and a lab test. Now coming to biopsy of tissue. Biopsy of the tissue can seen under directly or through endoscopy. So second, we are seeing PAPS test. PAP test is nothing. It is a cytological staining. Here we are take a smear from a affected area. For example, cancer of a cervix. They are taking a smear in the genital area, and by staining and observing the proliferation of the cancer cells, they are giving the results. And now coming to techniques like radiography, I already told you, X-rays, computer tomography, magnetic resonance imaging are very helpful to detect cancer in the internal organs. And now coming to CT X-rays. These techniques are used to generate a three-dimensional image to detect the internal organal cancer. And in MRI, it is a strong magnetic field and non-ionizing radiation are used to detect the pathological and also the physiological changes in the living tissue. So, antibodies against cancer-specific antigens are also used for detection of certain cancer. If we collect the blood, if we see any antibodies which is against the cancer, means if it is present in our body, means there is some indication some cancer cells are growing in our body. Because the presence of cancer cells in our body only, these antibodies are produced in our body naturally. So now coming to techniques of molecular biology can apply to detect genes in individuals. So last one is mammography. We all already heard about this mammography. It is an examination used to detect breast cancer. So these are the detections and diagnosis the techniques of a cancer. Okay, here I mentioned sites of the cancer we all to know. So first one is skin cancer. These are the parts we are getting prone to cancer. So first one is skin cancer, mouth cancer, esophagus, stomach, colon cancer, rectum, liver, gallbladder, pancreas, blood, lymph, adipose tissue, lung, uterine cervix, breast, brain, penis, prostate, muscles, thyroid, kidney, and bones. These are the sites and organs we are expected to get cancer due to internal and external triggers of carcinogens. Okay, so for men, very most common cancer is prostate cancer. For women, cervical and breast cancer is the most common cancer. For both of them, lung cancer and colon cancer is most common. And we all observe the signs and symptoms and moving to the investigation part and diagnose the cancer. What we have to do next means we have to categorize the treatment based on the type, stage, and site of the cancer. And secondly, we have to give a common protocol treatment like removing of the tumor through surgery, or chemotherapy to destroy the cancer cells, or if in any need of a radiation therapy. These are the techniques we have to apply secondly. By third, we have to give a combination of treatment. If the patient is having a severe condition of cancer cells, if the patient is needed to give a combination treatment like chemotherapy along with radiation therapy, we have to proceed with the combination of treatment in order to uh, destroy the cancer cells effectively. And so here we will briefly discuss about the treatment of the cancer. So first one is surgery. Surgery is a nothing removal of the entire cancer tissue by through incision. And second one is a radiation therapy. Radiation therapy already we discussed by applying the X-rays to the affected part of the body to reduce the to destroy the cancer cells. So here they are using radon, cobalt, and iodine radioisotopes for a radiation therapy. So third one is immunotherapy. Immunotherapy is nothing. We are promoting our immunological defense mechanism in our body by giving a radioimmunotherapy treatment. It will affect the cancer cells rather than the normal cells. And now coming to last one is chemotherapy. Chemotherapy, it is best treatment used to cancer. So here they are giving anti-cancerous drugs to inhibit the DNA synthesis or to reduce the cell proliferation. It is more toxic to cancer cells than to normal cells. The chemotherapeutic drugs kill cancer cells only, but it has some side effects like hair loss, anemia, and weight loss. So okay, now we all previously we seen what are the common therapies or treatment we are using these many days. Here I am introducing sorry, I'll inform the two advanced therapies currently they are practicing. One is a targeted therapy and second one is a CAR T cell therapy. So in targeted therapy, they are giving means they are target the specific genetic mutation in cancer cells. It has a less damage compared to chemotherapy. So here what they are using means EGFR inhibitors for lung cancer and HER2 targeted drugs for breast cancer and BRAF inhibitors for melanoma. And second one is CAR T cell therapy. So it is a very advanced technique. Here they are taking the patient's T cells and modified in the lab to attack cancers. So it is highly effective in blood cancers. We all so it is used for leukemia, lymphoma, multiple myeloma. So these are the advanced techniques currently they are following to treat a cancer. Okay. So, living with the cancer. So, the person who is affected with the cancer not only need a therapy like a treatments like radiation, chemotherapy, medicines, drugs, but they also need a physical, emotional, and a psychological support. So, for this, we have to provide a palliative care like support systems, including counseling and motivational talk to give family cope. This will improve their mental stability to maintain to survive the cancer condition. So during the treatment of the cancer and after treatment also we have to provide a palliative care. Okay, now coming to so previously we see about what is cancer, what are the types of cancer, how it cause, and where are the organs and site it get affected, what is the diagnostic methods, and what are the therapies treatment they are following to treat a cancer. So now coming to a naturopathic understanding, according to Dr. Willard J. Bisk, he is one medical medical person. He state that incidence of cancer directly proportional to amount of animal protein. Like if the person is if the normal person is consuming more amount of animal protein, so during the time of ingestion it release or it synthesis release ammonia. This ammonia in our body can lead to cancer. This is according to Willard, this is the cause of cancer. And now coming to treatment, what are the treatment means to treat the cancer basically it is to treat the cancer during the time of any other treatment or after a treatment. So first we have to cleanse the system by relieving constipation. So here we can give warm water enema, not only by relieving the constipation. Cleansing the system is also depends on the other organs like urinary bladder and liver, skin, lungs. Through respiration, through sweat also, our body will detox. So we have to promote those things also. And the next is nearly 4 to 5 days, the cancer patients should consume only juicy fruits. For example, orange, pineapple, lemons, apple, peach, pear, and tomatoes. After this, patients should take any alkaline based diet like fruits and vegetables. So, by following this, the person should need a minimum protein, like minimum requirement of high protein from vegetable sources only, because animal source of protein cause ammonia and leads to cancer. So here we are concentrating on a vegetable source of protein, which is presented in almonds, millet, sesame seeds, sprouts, and grains. So after this, we have to give a localized or partial sun bath twice a day, followed by heat bath. So if we are asked to we ask the patient to take a sun bath in the localized area or partial sun bath. So after taking the sun bath, the patient has to undergo to hip bath, neutral hip bath. And after this, we advise to the patient to take a steam bath twice a month to detox the body, and along with the wet sheet bath twice a month. Now coming to bed mat pack. Bed mat pack, we ask the patient to apply bed mat pack on abdomen before going to sleep every day. So last is if the patient is having any painful area or any bleeding, means we have to apply the cold pack continuously, and we have to change this cold pack periodically. So these are the protocol for an cancer patients. And here we are coming to a diet therapy. What are the foods, what are the vitamins, minerals are used to diminish the proliferation of the cancer cell, or helpful in reduce the risk of the cancer, or helpful to increase the life expectancy of a cancer patient? Here I mentioned a few of the things. So first one is a fresh wheatgrass juice. If the patient is having a leukemia condition, blood cancer, means the particular patient has to consume a fresh wheatgrass juice. It will gives a effect on leukemia. And second one is grape cure. This grape cure is the term derived by Jonna Brand. The person who is having a cancer undergone or experimenting herself on a grape milk every 2 hours. So once she used to consume minimum 60 grams to maximum 250 grams of grapes only. So over a 9 years of cancer, she states that she recovered from a cancer by taking only grape milk. And now coming to according to American National Cancer Institution, they states that about 1/3 of cancer linked to diet. ஸோ ஒரு மூணுல ஒரு மடங்கு இருக்க பர்சன்ஸ் வந்து அவங்களோட கேன்சர் வந்து டயட் மூலியமா தான் லிங்க் ஆயிருக்கு. ஸோ அவங்களோட சிம்டம்ஸ், சைன்ஸ் எல்லாமே வந்து ப்ராப்பர் டயட் எடுக்கும் போது ரெடியூஸ் ஆகுதுன்றத அமெரிக்கன் நேஷனல் கேன்சர் இன்ஸ்டிடியூஷன் ஸ்டேட் பண்ணியிருக்காங்க. தென் ஹெல்த்தி ஃபுட்ஸ் கிரியேட்ஸ் கெமிக்கல் ஆக்டிவேஷன் இன் அவர் பாடி, thereby preventing cancer. So while we are taking the healthy foods, it creates a chemical activation in our body and prevent a cell growth in our body and preventing cancer. So we all know antioxidants and vitamins can eradicate cancer. So here they mentioned a few of the vitamins. I explain laterly. And these antioxidants and vitamins even repair the damaged cells also, and it prevents further spreading of cancer cells. Okay, next, Dr. Peter Greenwald, director of the Division of Cancer Prevention and Control at the American National Cancer Institute. He states that people who eat more fruits and vegetables are less likely to get colon and stomach, breast, and even lung cancer. ஸோ டாக்டர் பீட்டர் என்ன சொல்றாருன்னா, லைக் த பர்சன் ஹூ இஸ் ஒரு பர்சன் வந்து நிறைய ஃப்ரூட்ஸ் அண்ட் வெஜிடபிள் எடுக்கிறாங்க கம்பேர் டு யார் எடுக்காம இருக்காங்களோ, அந்த பர்சன்ஸ்க்கு கோலன் கேன்சர், ஸ்டொமக் கேன்சர், பிரஸ்ட் கேன்சர், ஈவன் லங் கேன்சர் கூட வரதுக்கு சான்சஸ் ரொம்ப கம்மியா இருக்குன்னு சொல்லி இவர் ரிசர்ச் ஃபவுண்ட் பண்ணியிருக்காரு. அண்ட் நவ் கம்மிங் டு eating fruits 2 times per day, less than 3 times per week can cut the risk of lung cancer, 75% even in smoker. So one research states that ஒரு நாளைக்கு 2 தடவை நம்ம ஃப்ரூட்ஸ் எடுக்கிறது நம்மளுக்கு 75% ஆஃப் லங் கேன்சரை வந்து ரிஸ்க் வந்து கம்மி பண்ணுதுன்னு சொல்றாங்க. ஈவன் இன் ஸ்மோக்கர் ஆல்சோ. The person who is smoking also, if the person is consuming 2 times of fruits per day, means 75% of risk will reduce. And in American National Cancer Institute include anti-cancerous vegetables and fruits. So in the American National Cancer Institute, சில fruits வந்து and vegetables it is considered as an anti-cancerous to mention பண்ணிருக்காங்க. Here I mentioned some of them: garlic, orange, cabbage, grapefruit, tomato, lemon, lime, soya beans, ginger, carrot, celery, onion, broccoli, cauliflower, cucumber, Brussels, and sprouts. These are the vegetables which is considered as a anti-cancerous. And some other foods also acting as a anti-cancerous. Here I mentioned turmeric, whole wheat, brown rice, and barley. So other than like except foods, fruits and vegetables, some of the herbs also plays a major role in anti-cancerous uh, property. So here I mentioned rosemary, sage, thyme. Sage is nothing; it's a karpuravalli. Thyme, chives, basil, berries. So these are the herbs which is helpful in cancer patients. And University of Pennsylvania Medical School, Dr. Otto Meyerhoff states that excessive intake of sugar called the appetite of tumors for sugar. He suggested by curing this appetite may stops the growth. ஸோ டாக்டர் ஓட்டோ இவர் இங்க என்ன எக்ஸ்பிளைன் பண்ணியிருக்காருன்னா, ஒரு பர்டிகுலர் கேன்சர் செல்ஸ் க்ரோ ஆகிறதுக்கு அதுக்கான அப்பிடைட், அதுக்கான பசி பார்த்தீங்கன்னா சுகர். இப்போ சுகர் கன்சியூம் பண்ணி அந்த கேன்சர் செல்ஸ் அதுக்கு எனர்ஜி மாதிரி. ஸோ அது வந்து இன்னும் நல்லா ப்ராலிஃபரேட் ஆகுது, மல்டிபிள் ஆகுதுன்னு இவர் மென்ஷன் பண்ணியிருக்காரு. அப்போ நம்ம அந்த ப்ராலிஃபரேஷனை கம்மி பண்ணணும்னா அதுக்கான அந்த பசி சுகரை நம்ம கட் பண்ணிட்டோம் அப்படின்னா நம்ம வந்து இந்த கண்டிஷன்ல இருந்து கியூர் ஆகலாம் அப்படின்றது டாக்டர் ஓட்டோ இங்க மென்ஷன் பண்ணியிருக்காரு. Now coming according to Swedish studies, vitamin C act as a prophylactic agent and against cancer. Previously I mentioned vitamins and antioxidants or plays a major role to reduce the risk of the cancer. Here vitamin C plays a major role in prophylactic agent. And Japanese scientist Dr. Fukinir Mirisco and his colleague found mixture of vitamin C and copper compound has lethal effect on cancer by producing toxic free radicals inside tumor. So here what they are describing means in cancer cells we already have a copper compound inbuilt. So if we are giving vitamin C means it combined with copper. ஸோ விட்டமின் சி அண்ட் காப்பர் அந்த காப்பரும் விட்டமின் சியும் காம்பைன் ஆகும்போது அது வந்து அந்த செல்ஸ்க்குள்ள ஒரு லீத்தல் எஃபெக்ட் கிரியேட் பண்ணும். அதாவது டாக்ஸிக் ஃப்ரீ ரேடிகல்ஸ் கிரியேட் பண்ணி அந்த பர்டிகுலர் கேன்சர் செல்ஸை வந்து டெத் கிரியேட் பண்ணும். ஸோ இதை தான் இவர் இங்க மென்ஷன் பண்ணியிருக்காரு. ஸோ ஆல்ரெடி கேன்சர் செல்ஸ்ல காப்பர் இருக்கிறதுனால நம்ம விட்டமின் சி அப்ளை பண்ணும்போது ஒரு லீத்தல் எஃபெக்ட் கிரியேட் பண்ணுது அப்படின்றத மென்ஷன் பண்ணியிருக்காங்க. அண்ட் செகண்ட் விட்டமின் இஸ் விட்டமின் ஏ. Already we saw about vitamin C, and here vitamin A has a inhibiting effect on carcinogenesis. And British study found that cancer rates dropped 40% in men with most blood beta carotene. So இவங்க பிரிட்டிஷ் ஸ்டடி என்ன ஃபவுண்ட் பண்ணியிருக்காங்கன்னா, விட்டமின் ஏ நம்ம கன்சியூம் பண்ண பர்சனுக்கு வந்து மென்ஸ்க்கு அப்சர்வ் பண்ணியிருக்காங்க 40% அவங்க பாடியில பீட்டா கரோட்டின் இருக்கு. ஸோ அவங்களோட கேன்சர் ரேட் வந்து 40% கம்மியாயிருக்கு. ஓகே, ஸோ விட்டமின் ஏ பிளேஸ் அ மேஜர் ரோல் இன் கேன்சர் பேஷன்ஸ். And folic acid, lycopene, which is present in a tomato, it is less vulnerable to all cancers, particularly cervix, lung, and pancreas. And Japanese study found that இவங்க என்ன சொல்லியிருக்காங்கன்னா, green and yellow vegetables நம்ம எவ்ரிடே கன்சியூம் பண்ணும்போது லங் ஸ்டொமக் கேன்சரோட ரிஸ்க்கை வந்து நம்ம ரெடியூஸ் பண்ணலாம் அப்படின்றத சொல்லியிருக்காங்க. அண்ட் கம்மிங் டு ஹார்வர்ட் யூனிவர்சிட்டி, ஸோ மோர் தென் 1200 elderly Massachusetts residents found who consumed carrot, squash, tomato salads green leafy vegetables, dried fruits. ஸோ இந்த இடத்துல என்ன ஹார்வர்ட் யூனிவர்சிட்டி ஒரு ரிசர்ச் ஃபவுண்ட் பண்ணியிருக்காங்க. லைக் ஒரு 1200 எல்டர்லி பீப்புள்ஸ் வந்து கேரட்ஸ் அண்ட் பம்கின், டொமேட்டோ இந்த மாதிரி கிரீன் லீஃபி வெஜிடபிள்ஸை மட்டும் கன்சியூம் பண்ணவங்களுக்கு கேன்சரோட ரிஸ்க் ஃபேக்டர் வந்து கம்மியா இருக்கிறத இவங்க நோட்டீஸ் பண்ணியிருக்காங்க. அண்ட் ஸ்ட்ராபெரிஸ், மெலன் ரெடியூஸ் த ரிஸ்க் ஆஃப் கேன்சர். Okay. So, previously we saw what are the foods, what are the sources of foods helps to reduce the risk of the cancer and helps to improve the life expectancy of the cancer. It is used to treat the cancer, not for the cure. And now coming to prevention. So, however, it is more important to prevent rather than treating the disease. So, we best way to prevent cancer to build up the body's defense through excellent nutrition. If the person is or in a healthy state means that person is cannot take hold. The cancer cells can't take hold in our body, right? So we have to maintain a healthy state. So to achieve this, we should follow completely like avoid all refined synthetic and processed foods. For example, white flour, enriched fortified foods, white sugar, and food with the chemical additives. ஸோ இந்த கைண்ட் ஆஃப் ஃபுட்ஸை நம்ம கம்ப்ளீட்டாக அவாய்ட் பண்ணும்போது நம்ம பாடியில் இருக்க ஆர்கன்ஸ், செல்ஸ், டிஷ்யூஸ் எல்லாமே வந்து ரொம்ப ஹெல்த்தி ஸ்டேட்டில் இருக்கும். ஸோ இப்போ ஹெல்த்தி ஸ்டேட்டில் நம்ம இருக்கும் போது கேன்சர் செல்ஸ் நம்ம பாடியில் க்ரோ ஆகிறதுக்கான சான்சஸ் ரொம்ப கம்மியாக இருக்கும். So these are the preventions we have to follow. Nothing, we have to consume excellent nutrient food which is presented in a natural food and fruits, vegetables. So what is the advice means so advisable foods to prevent cancer is whole foods, natural foods, raw vegetables, fruits, protein from vegetable source like milk and whole grains. So I already told you animal source of protein produce ammonia, which is a primary causative agent for cancer according to naturopathy. So here we should not consume protein in animal meat. We have, instead of that, we have to go with the vegetable source. So rather than food and fruits, we have to concentrate on a plenty of rest, free from mental stress, and fresh and pure hair. So these are the things we have to follow. So in this presentation, we have seen what is cancer and how it is caused, what are the irritants, triggering agents, and how it shows the signs and symptoms, what are the investigation methods we are following to detect a cancer, and after the investigation, what are the therapies we are applying to a particular cancers, and what are the types of cancer, what are the sites of cancer, and what is the food we have to intake during the time of cancer also and after the treatment also. We can give a combination, like if the patient is undergoing for a chemotherapy, we can consume one healthy food means it promote the chemotherapy treatment. So it's a combination thing. And lastly, we have seen a prevention and advices. So in conclusion, cancer awareness plays a vital role in prevention and early treatment. By understanding the risk factors and adopting healthy habits, we can protect ourselves and our communities. So let us all take responsibility for a healthier tomorrow. Thank you.